So I am continuing with the vector aspect and mainly about the transmission, risk factors, and the risk mapping, forecasting, and all. So let me proceed with that. This is just to give you an overall idea about the global perspective. If you see, nearly about 400 million dengue infections are being recorded year after year from about 128 countries are at risk of infection. We had worldwide, if you look at the data, in 2016 we had a large scale outbreak, and in 2017 there was a significant reduction was reported, and again in 2019 there was a sharp increase in the case of dengue, not only India but also worldwide. And in the recent past, there was a worst outbreak in Delhi with over 15,000 cases. So that was the recent past experience, and especially after the COVID-19, we had a small lull in the incidence of infection due to various reasons, especially in the year 2020. But again in 2021, there is again, it has started increasing. Why it is so? We have to analyze the reasons. Do we have, I do not know whether you heard about the immunization part from my colleague. Just I want to share with you a few information about what we have in hand. In the year 2015, a company called Sanofi Pasteur in France has come out with a vaccine called Denvaxia. And the WHO has given permission in about 20 countries for its use, especially in endemic areas. And it is only for the people who are aged between 9 and 45 years of age. We have had some issues with this vaccine. The of the zero prevalence above 70% only, we have been advised to use this vaccine and not the other areas, because the analysis made in 2017 was not encouraging, especially in areas where there is a very low incidence of dengue, and in such places it was giving an adverse effect. Therefore, it was not a success story. And know about the vectors. I hope that you all will be familiar with the mosquitoes responsible for the transmission of dengue. That is, one is Aedes aegypti and another one is Aedes albopictus. In the Aedes aegypti is also reported in as a secondary vector. But the main vector is Aedes aegypti, especially in urban habitats, and the albopictus in rural habitats. They mostly breed in man-made containers. I hope you all are aware. And also you will be knowing that it is only biting during the daytime, especially in the morning and also in the evening. And only female mosquitoes will bite. And unlike other mosquitoes, the Aedes mosquitoes will go for multiple feeder, because it will the tendency is to take one blood meal. It will visit 2-3 people, sometimes up to 4 people it will visit and for one blood meal. In that process, it will take the full blood meal, but at the same time, if it is an infected mosquito, it will pass on the infection to 3-4 people wherever it goes for, to whomever it bites. And Aedes eggs can remain dry over a year period. So it is having the capacity to withstand the temperature. Therefore, it will not get desiccated. Once it gets water, then the eggs will hatch into the immature stages, that is larvae. Then Aedes albopictus, a secondary dengue vector, is highly adaptive and tolerant to temperature, even below freezing temperatures, and it will undergo hibernation and ability to shelter in microhabitats. And these are all the very familiar to you. These are all the vector breeding habitats. Interestingly, for those who are non-vector people must know that many a times during especially during dengue outbreak season, the media people used to show the drains and the gutters, which are all polluted water bodies. Actually, it's a freshwater breeding type of mosquitoes, and it will not breed in water having direct contact with the earth. So these are all defined breeding habitats, and it is easy to control, but the people say that it is difficult, but in reality it is not so. And interestingly, the albopictus breeding in rural areas. This photo was taken from Kerala, Kottayam area, where there are a lot of rubber plantations. You must have heard that the chikungunya outbreak happened in 2004-5. In large scale outbreak was there because of this abundance, enormous breeding of albopictus that created a havoc in many places, including in Chennai metros and many southern part of India, and worst affected area was places like Kottayam in Trivandrum, Kottayam in Kerala, and where even these are all rubber solution cups, lactose collection cups, where you can see the water, rainwater. And here the mosquito albopictus is one of the preferred breeding habitat. And most, I hope you are all very familiar with this thing. It will take about 7 to 10 days for from it to become the adult mosquito. And transmission. Dengue virus is transmitted by Aedes aegypti and albopictus, I told you just now. And it is also responsible, the chikungunya is also transmitted by Aedes mosquito. And recently you must have heard about the Zika. Zika is also transmitted by Aedes mosquitoes. And the incubation in mosquito, again, it takes about a week, 4 to 10 days. That is called the extensive incubation period. An infected mosquito capable of transmitting the virus for the rest of its life. Once acquired means for the rest of the life it is infective. Same way, trans-ovarial transmission is also possible. That means once it got infected means the female mosquito, even the virus will pass on through the eggs, and it will go to the next generation. So that is the problem with the dengue transmission. So the trans-ovarial transmission is there, and again, one time got infected means the rest of the life it is remains infective. So these are all some of the problem with the dengue incidents. These are all, you know, that just I have given an illustration to show how much time it takes for the to undergo multiplication of the virus in the mosquito and also fever. And assessment of the risk of transmission of dengue. So we are more interested in the entomological risk. That means the vector prevalence. First, the very existence of the vector is important. Second, the abundance, that is density. Higher the density, more risk. And seasonality. And it is not the transmission is not perennial. It is only seasonal. That too about the post monsoon. And here again, there are two types of areas. Some places it is rain dependent. Some places non-rain dependent. Especially where the rainy, the water scarcity are there and the more rain is less. In such places, the water storage practice will be there where we can see the non-rain dependent areas. Okay. Now the entomological surveys. When you go for the Aedes mosquito survey, you will be generally looking in the villages or even in the urban areas. You will go for inspection of the intra and the peri-domestic area, looking for water containers with immature forms, both larvae and the pupae. And here, the care should be taken to account only the containers holding water to be included in the count. And for your survey, when you go for the calculation of the indices, you need to take only the containers with the water. This is very important. Many times people may have doubt. Containers are there whether to count or not to count for this purpose. And you can very well enlist them as the potential breeding habitat, but for the calculation purpose, you go to account only the containers with the water. Then collection of the immature forms, both larvae and pupa. Then the data to be collected used to estimate the breeding indices. There are different 3-4 indices are there in the case of the Aedes mosquito. One is called the host index. Again, only for this Aedes mosquito we have this kind of indices, not for other mosquitoes. That also you have to be you should be aware. One is house index, second one is container index, third one is Pareto index, and the people index last. This people index was during the recent past because it is an indirect indicator of the related to the adult population. Therefore, the people index is also vital and now it is included. And you can see the WHO publications, the manual, where you will have a detailed account of these indices and the method of collection procedures are also available. And when you go for an area for sampling purpose, especially for the assessment of your operations, program evaluation, and also for the research studies, the sampling design is very important. You have to seek the help of statisticians, then they will tell you about how to, your sampling methodology and also for the sampling size, where to collect, how many sites to be visited, how much what is your target. All these things you will get from the statisticians. So here you see there are 3 stages. First, you have to see the identification of the breeding sites, where you will look for the types of containers. And second is the entomological study, where you are going to have the breeding indices like I have already told you about the several types of index or indices in plural. And once you got these things in hand, you will be able to determine the area as such. at whether it is at a potential risk of transmission. So here you have to see some of the things likely to be missed. When you go for survey, generally we will have a tendency to look only for the artificial or the man-made, the breeding habitats like the containers, tires, and all. But there will be a tendency to ignore, especially in both rural and also urban areas. You have to look for the vegetations, especially the trees and the tree holes. Otherwise, you will be missing, and this will go on produce a persistent. The production or the proliferation of the vector will be there in tree holes. And if you have the for other containers, easily you will take the dispose it of under the solid waste management system. But in the case of tree holes, it is very simple. Only thing you have to identify the tree holes, then you have to fill it with the sand. That's all. Very simple. Solution is simple. You don't have to have high tech is not required here. And the man-made water supply and storage practice is very important because in many urban areas, they don't. The people, especially in suburban areas, that the people do not give adequate care to for the lid. So if it is not properly closed, covered with the net or solid in plate, solid cover all the net. If it is not there, then that will be a potential source for the breeding. So therefore, the types and quantity of solid waste production and the disposal practice is also another vital thing to be considered. Again, this is also one of the major risk factors. So what is the calculation of the house index? It's the number of houses positive for larvae or pupae divided by number of houses into 100. That is called a house index. And that will be in percentage. All other indices like the Brito index, there is a number of positive containers divided by number of houses surveyed into 100. In container index, number of positive containers divided by number of containers into 100. These are all index, they are only numbers. So we don't have to put the percentage here. The another important thing is the people productivity, PPA per person index, that is called a PPI, the ratio of PPA and the persons living in each area or cluster of areas or a given geographical confined area. It can be a village, it can be a cluster of villages, or it can be a PSC, anything you can take. Then PPA per container index, that is the ratio of PPA and containers surveyed in each area divided by the clusters. So these are all the important indices of entomological indices of the Aedes. And this slide is very important in the sense you are having you have gone for the survey, collected the immatures, calculated the house index, Brito index and all. What is the inference? Suppose if the house index is less than 1, it is considered little risk, no or little risk, no risk or little risk. If it is above 1, it's a low risk. And if it is above 5, it's high risk, and above 10 means very high risk. According to the Ponde and his colleagues worked out in 2000, and still it is valid in many places. But you can ask, sir, here it is only 1% is there, but still incidences are coming. Yes, if the other factors are more conducive, especially in the area that a large number of the infective carriers are there, even the low risk will have a higher incidence of cases and vice versa. And these are all in general we can accept for the prioritizing your control measures or interventions. And Pareto index, if it is below 10, it is low risk. 10 to 50 is a moderate risk, and above 50 means a very high risk. It is according to the World Health Organization 1997. And in Cuba, one gentleman, Janche, in 2006, has made that is applicable in his locality. He has made, if the Pareto index is more than 4 in a radius of 100 meter, and neighborhood areas, if it is below above 1 means in the preceding months means predictive discrimination he has used. Same way, we in VCR Vector Control Research Center also we have come out with some idea on these aspects, not with the Pareto index, but with the other factor which I shall tell you later. Then climate factors, that is rainfall. If it is a very heavy rain, then you can very well expect that is a washing out effect of the breeding habitats. If the rain is sporadic and intermittent and the number of rainy days are more, definitely you can expect a high proliferation of vector mosquitoes. And the temperature is a very important factor. That is called like daily you'll be recording the daily minimum and also maximum. And you take the minimum average and also maximum average. And if you can make a difference between the mean minimum and mean maximum, that is called diurnal temperature range, DTR. That is nothing but the difference between mean minimum and mean maximum. The difference between the mean minimum and mean maximum is daily temperature is called TDR, because we are going to use this TDR in subsequent slides. Therefore, I am insisting or giving more emphasis here for the TDR. So these are all the factors considered for the risk assessment. What are they? One is about the environment, that is physical and climate. Then the risk of transmission, entomology and parasitology. Then risk of exposure related to the people, demography and the socio-economic status of the community. Depending upon the risk exposure on infection, you can very well expect the disease to occur in a given area and point of time. So for any model transmission, we have to construct a conceptual framework for the particular disease. Here we have made for the dengue transmission, this is a conceptual framework taking into account the major factors responsible for dengue transmission. One is the entomological factors, another one is climate factors, and the third important factor is the human factor. That is in terms of population density, then sanitation, waste disposal, rainwater harvesting, and the industrial water storage. So all these things are contributing to or facilitating factors for the potential risk of transmission. So for risk map, these are all the basic requirements. One is the map of the location map or the regional map or the site map. Then we need to have the socio-environmental data, their knowledge about the dengue and water storage and waste water storage practices and waste disposal status, to what extent it is being implemented. And the entomological data, I told you about the several indices and the epidemiological data. If you have all these things in hand, then you can assign the risk score so that you can take these risk scores into the GIS platform, Geographical Information System platform. Then there is a provision to collect these informations on the regional map or the location map, what you have in hand, and if you can pull this data informations, and you can make a simple formula for using this data, and you'll be able to come out with a potential transmission risk map for dengue in a given area for a particular context. That means in a year or a season. And this is the map which we have produced recently for the dengue transmission map in Puducherry, Pondicherry. And you will be wondering what are all this, why it is fragments. People in Pondicherry will be knowing that Pondicherry is a union territory where many places within Pondicherry you have Tamil Nadu area will be there in between. Therefore, it looks like a fragmented picture. In India map, when you see, you will have only a big dot. But if you go and see closely, it is you will have the fragment kind of picture because of a lot of the Tamil Nadu area in between. Okay, about the we have taken into consideration here the people's perception of the knowledge or the knowledge about the transmission, and then waste disposal and water storage practice, Brito index, container index, house index, all these things I told you about the critical point. To what extent, suppose if it is low endemic, you can give a score. If it's a high, high Brito index, you can give a higher number score. And if you can give for each, depending upon the score of the particular area, you are going to have a cumulative figure for each area, and based on which the map is created. If there is a high score of all combined score, then it will be the area will fall in red. That means a high risk of infection or transmission, followed by the gray, yellow color, and relatively less, that is a green color. This is an interesting finding we have found in Puducherry, where we have made a graph. You can see on the left, the cases have been plotted during the different months in 2012, where I told you about the TDR, diurnal temperature range. That is the one which is, this is the TDR. You can see there is a reduction here. In the following month, the cases are high. That means what? The TDR was negatively correlated with the number of cases reported. The occurrence of dengue fever in relation to climate variables in Puducherry, southern India. This we have published. And interestingly, during the in 2015, in Delhi, I told in the beginning, there was an outbreak. A large number of people got affected in Delhi in the month of September. In the month of September, here, there are several thousand people got infected. And there were, we have been asked what could be the reason for this occurrence of a high level of transmission. Interestingly, if you can see, this is the place where we have got this TDR. We have calculated this TDR, it was very low here, and in the following month, there was a high incidence of cases. So the TDR is having, how it is happening, this conducive temperature, maybe it is between 28 to 32 degrees Celsius. If it is, that TDR is persistent over a period of maybe about a week or 10 days, then in the subsequent months, you can expect a high level of transmission. How? Because that is the temperature responsible for the multiplication of virus inside the body, essential incubation period. Therefore, there is the likelihood of transmission is high. When the vector density is also high and this conducive temperature is also persistence available, then naturally there is a potential risk of transmission in the subsequent month. This is what we have observed. In the, I have shown you only two places here, but after 2015, almost year after year, I look at the data from different parts of the country and also from abroad. This phenomenon still holds good, and this has been brought out. We have published this information also. So the dengue, how we can prevent or make an effective control in India, a way forward through integrated strategy and public-private partnership approach. For example, integrated epidemiological and entomological surveillance is required, and advocacy at all levels are needed, involving, because many people are responsible for this contribution of the breeding habitats. Therefore, we have to involve all the sectors and the effective community participation, of course. Then integrated strategy continues with environmental management and addressing basic services such as water supply, disposal of used water, solid waste management and disposal of used tires, and patient care within and outside the health system. And the case reporting, I think now the case reporting has been made mandatory, but I wonder whether all the private the practitioners and hospitals are to what extent they are reporting to the health system is still a question mark. Then incorporation of the subject of dengue health into the formal education. I think in some education system it is already it is introduced, but I do not know whether across the country all the education system has incorporated the dengue aspects in the education system. Is still we need to go a long way. Then the critical analysis of the use and functions of the insecticides. Whenever there is an outbreak, immediately people, the health system is interested in going for malathion thermal fogging, but it is not helping much. They know, but unfortunately people do not know, but the media people are behind this kind of thing. And as a result, we continue to depend on this, but it is of no use. But we need to go for environmental sanitation. That is the best option. Okay, then a formal health training for the professional and the workers are still it is required, and the emergency preparedness and establishing mechanism and plans to phase out outbreaks and epidemics are also paramount. And this is one of the recent technology the ICMR, especially Vector Control Research Center, has undertaken a very interesting study. That is, the insect population, about 70% of the insect populations are having a bacteria called Wolbachia, like what we human beings are harboring the lactobacillus in our system that helps for digestion. Same way, the Wolbachia parasites are in the insect population, but not all the vector mosquitoes are having this Wolbachia, especially Aedes aegypti. By and large, they do not have this bacteria. But if this bacteria is introduced into the Aedes aegypti mosquito, then this will prevent the multiplication of the dengue virus. And this technology has been successfully demonstrated in the Monash University of Australia. And they have demonstrated this about in 10 countries around the world. Therefore, in India, the ICMR BCRC has, in collaboration with the Monash University, got this technology transfer to BCRC, and we have tried to develop the Wolbachia carrying Aedes aegypti and also Aedes albopictus mosquito. Now we have successfully demonstrated in the production of Puducherry strain of Wolbachia carrying Aedes aegypti and Aedes albopictus. Now we are ready to go for pilot scale study and after a regulatory approval by the government of India. And again, there are several limitations are here. It is not very easy to operate. In the lab, it is successful, and at pilot scale, if it is a very small island, may be possible to demonstrate. In a country of having this much size, our country, it's a large area. We may require several millions and millions of mosquitoes to be, produced with this Wolbachia, and we have to introduce it to the system. It's unimaginable, but theoretically, if you see, it looks very sound to hear. So areas need a special attention is a policy, epidemiological data availability, then the training is the need of the training, operative alliance, that is eco clubs, industries, commerce, school, intersectoral collaboration, then technical assistance, then consultation, monitoring and evaluation. All these things we know and we are capable of doing, and we have to have, but unfortunately we do not have a strong policy to advocate. If the policy is a strong policy to advocate, then it will we can take it to the program, and that can be translated into action that will end in success. Thank you so much for your patient hearing. I think I have completed in 40 minutes, and we can spend about 5 minutes or even more for interaction. If you have any query, I shall be happy to clarify. Thank you.